I'm African by birth, Indian by origin, American by citizenship, but a Utahn by choice.
Dinesh is all Utah at this point. Like, we wouldn't let him go if he wanted to. I mean, he's such a huge figure in Utah and such an important figure in Utah. And it's in not just the business community, but the philanthropic and the political community.
Denesh is truly a pioneer of therapeutics and pharmaceutical development and manufacturing here in the state of Utah.
In Utah, we call him the Godfather of Medtech because he's so involved at an early stage in giving of his time and energy, and sometimes his money. He has a number of exits to his name. You won't see too many things that have promise in Medtech that he's not involved in here in Salt Lake City.
And Dinesh has been a critical part of this state's economic and business success. I would argue that we would not be where we are today as one of the leading states for business in the country without the help of Dinesh Patel, without his leadership, without his vision, without his willingness to engage.
In this episode of The American Journey, we share the remarkable story of Indian-American entrepreneur and philanthropist Dinesh Patel. Dinesh C. Patel was born in 1950 in Broken Hills, now known as Kabwe, in the then British colony of Zambia in south-central Africa. He was one of the 4 children of Chotabai Patel and his wife Savitaben, who had moved to northern Rhodesia from the western Indian region of Gujarat.
So my grandparents went from India to Zambia in the 1940s. Africa was under British rule, so a lot of Indians going to Africa at that time, and he went there as a school teacher, but then later went on to start a printing business.
Young Dinesh grew up in the segregated world that was the South Central Africa of the mid-20th century.
Our city, we had one area where all the Indians lived, there was one area where all the white folks lived, and another area where the black folks lived. Our primary school or our early schools were all segregated. There are certain areas where you would not want to go because it's all white and you felt not very welcome. But a lot of our teachers were white.
Early on, one of the biggest influences in Dinesh's life was his father, a man of considerable leadership quality and a committed philanthropist. Chotabai left a lasting impression on Dinesh and his siblings, 2 brothers and a sister.
So my grandfather, he was the first non-white councilman in his city council, and he was also very active in his community.
The Patels were part of a small but strong and tightly knit Indian community in pre-independent Zambia.
We did have a Gujarati school, so we did learn something. We could speak, we could write.
In 1968, after completing high school, Dinesh went to Ahmedabad, the capital of Gujarat, along with his 2 brothers for his undergraduate degree.
My grandfather wanted them to have some exposure to India and make sure that they know about their culture, which in Africa I'm sure they did to some extent because they were amongst a good Indian community, but it probably is not the same as just spending some time in India.
The choice was whether to go for medicine or for pharmacy. My feeling was always that medicine wasn't too appealing to me, but I wanted to do something more that could help human beings. And I thought in the pharmaceutical industry where you can create new drugs or develop some medicine or breakthrough medicine would be one way to help the human lives.
After earning his undergraduate degree, Dinesh decided to come to the United States for a master's degree.
We could have gone back to Zambia, but the economic conditions were getting pretty bad around there, and also there was no industry there, no pharmaceutical industry at that time. So US becomes your obvious choice. And I applied and got admitted to Philadelphia College of Pharmacy.
Before he left the shores of India, Dinesh married Kalpana Maganbai Patel, the daughter of a physician from the Bharuch region of Gujarat.
It was an arranged marriage. We had close family friends or relatives from Zambia who were related to Kalpana. So in '73, before I left for US, they said, you're going there, why don't you consider getting married and go? So that's what we did.
Dinesh and Kalpana arrived in the United States in the summer of 1973. Adapting to America was easy for Dinesh, having lived life as a minority his entire life till then.
Philadelphia College of Pharmacy or any major universities here, in the graduate school you have a lot of foreign students and of course a lot of Indian students. So initially it's just natural to mix with people that you're familiar with.
After earning a master's degree, Dinesh moved to the Midwest to enroll for a Ph.D. at the University of Michigan in Ann Arbor.
The reason for going to Michigan, it is one of the top schools, not only in the U.S., in the world. I got a scholarship from Michigan.
Dinesh and Kalpana were right at home in Ann Arbor, a vibrant university town where academics and sports intersect nicely.
Michigan is where we really developed friendships.
I had a good experience on campus, and we used to go to football game every Saturday, and I still watch Michigan football. We both are big fan of Michigan football.
Under the guidance of Professor William Higuchi, a renowned chemist and pharmaceutical scientist, Dinesh worked on his doctoral dissertation, which was on the mechanism of cholesterol's gallstone dissolution. By the time he finished the dissertation in December 1978, Dinesh was very clear about his career path, which was to gain some industry experience and then start his own business. With that goal in mind, he worked for 2 large companies in the next 6 years. Initially for the Pearl River, New York-based drug firm Leaderly Laboratories, and then the Ophthalmic company Alcon in Fort Worth, Texas.
My internal goal was by 85 to start a company, so I started thinking about what to do.
In mid-1984, Dinesh received a call from Higuchi, who by then had left Michigan to join the Department of Pharmaceutics and Pharmaceutical Chemistry at the University of Utah. Higuchi asked Dinesh if he was interested in working for Genentech, an up-and-coming pharmaceutical company.
My thought process is to start my own company, so I'm not looking at working for somebody. So he said, why don't you come to Utah? And University of Utah is very friendly about starting companies, and we can start that together.
The opportunity, which came out of nowhere, excited Dinesh, but Kalpana wasn't as enthusiastic.
At that time, I thought that he should not leave his regular job, because in those days it was a steady job and steady income, and this was a big risk kind of. I did not say no, but that was my feeling.
In February 1985, Dinesh and Kalpana arrived in Salt Lake City, a place he had never been to or knew no one except his 2 co-founders.
Somebody asked me, what are you going to do in Utah? There are a lot of Mormons there. And I said, well, in Texas there are a lot of Baptists. So for me it's the same difference. So I said, wherever I go, I'm still going to be a religious minority. And you know, we moved from Africa to India to the US, and now moving a few thousand miles from Fort Worth to Utah is not a problem.
In the mid-1980s, Utah and the Intermountain region were nowhere on the map of the biotechnology industry.
The biotech industry had some big centers back in the 80s, including in Boston and the Bay Area and Southern California. But outside of that, there weren't a lot of true centers of biotechnology. So coming to Utah was truly a leap of faith. There was still no other pharmaceutical or therapeutic industry here to speak of when he came.
Therapeutic Technologies, or Theratech, began operation at the University of Utah Research Park in November 1985. Its 3 founders, Dinesh, Higuchi, and Sun Won Kim, a University of Utah professor and a renowned expert on drug delivery, invested $40,000 each. Entrepreneur and friend Gary L. Crocker joined the company as a co-founder. It specialized in products based on controlled drug delivery technology.
Drug delivery means you get the medicine in the body at the right time and the right amount.
Dinesh was given the title of an adjunct professor at the university.
For the first Couple of years, I was the CEO, the janitor, the scientist, everything. I didn't know a lot or anything about the business at that time. Getting money from the bank, right? I mean, trying to get a loan, well, they'd say, well, what kind of assets do you have? At that time, there was hardly any venture capital or private equity in Utah. In fact, there might have been about $5 million. Gujaratis are all business people, and you learn on the go. I also realized that failure was not an option for me. You know, I moved, I started a company, I got to succeed.
In the next several months, as Dinesh built Theratech from the ground, Kalpana became the sole breadwinner of the family.
In the startup phase, you know, we didn't have a lot of money or anything, so Kalpana worked at the College of Pharmacy as a lab tech. She has a master's in chemistry, so she was able to start working there.
Many pharmaceutical companies were willing to support Theratech as drug delivery was a green field at the time. One of the firm's first big investors was pharmaceutical giant Pfizer.
From the time we broke ground to the time we launched our first product, it was less than 18 months, which is unheard of.
So there was product that they were able to develop, and they were able to begin marketing, and they had some success pretty quick for a therapeutic company.
In the next few years, the company manufactured several drug delivery products and transdermal patches. When Theratech completed a successful IPO in 1992, Denesh became one of the first Indian-American entrepreneurs to take a company public in the pharmaceutical industry.
That was a big event here in the state of Utah when Theratech went public.
In 1998, Watson Pharmaceuticals acquired Theratech for $350 million, which was one of the largest acquisitions in Utah at the time. A year later, Denesh left the company he founded and nurtured to begin the next chapter in his life.
I had a contract to be with the company for about 12 months. Once the transition was smooth, I moved on. And we started a venture capital fund.
V-Spring Capital initially raised $100 million and funded roughly a dozen biomedical companies. They included 2 startups founded and run by Denesh himself, Salus Therapeutics and Ashni Nutraceuticals.
It was quite challenging for a first-time venture capital fund, and all my partners were also first-time VCs. They all had an entrepreneurial background, but none from the VC community.
By 2014, the fund raised $400 million and invested in startups across a broad spectrum of sectors.
At that point, I decided to retire because every fund has a 10-year life cycle. And at that age, I didn't want to go raise money and be committed to another 10 years. I decided to move on and do my own angel investing.
In January 2014, Denesh launched a new firm to channel his angel investments. The current portfolio of Patel Family Investments includes more than 25 early-stage companies and 12 private equity and venture capital funds. Among the companies he has invested in and closely worked with are Xenocor, makers of the world's first single-use laparoscope, and Juno Biosciences, which does cutting-edge research in the areas of genetics and genomics, and diseases that disproportionately affect women.
He's been instrumental in getting us to where we are today. We've had a lot of early startup typical challenges, fundraising, figuring out products and how to make them.
Dr. Patel came and invested at an early stage in Juno, and when we invited him to join the board of directors, he gladly did so, and he's been a guiding voice for over 10 years at Juno Biosciences. He has made many introductions for Juno. He has held our feet to the fire when necessary as we're going through challenging times. I mean, the pandemic has been a very difficult time for a lot of companies at the stage that we were at as a research and development company. And so he's supported us through some of the changes that we needed to make to open up some new lines of business.
Theratech is not the only company Dinesh founded or backed that has gone public or has been acquired by a major company. MediConnect Global, a healthcare technology firm founded by Salt Lake City entrepreneur Amy Rees Anderson, was sold for more than $375 million in 2012. In addition to investing in the firm through vSpring, Dinesh served on the board of MediConnect. Dinesh's unswerving support for entrepreneurs and startups in the biotechnology and medical technology fields through investments and mentoring has helped Utah become a major hub for these two fields in the Intermountain region.
In Utah, we call him the Godfather of Medtech because he's so involved at an early stage in giving of his time and energy and sometimes his money. He's involved in a number of companies here locally that are at a similar stage. Early on, regulatory maybe has been done or they are going to regulatory approvals. They're fundraising, some are commercial. He has a number of exits to his name. And you won't see too many things that have promise in medtech that he's not involved in here in Salt Lake City. So we're very lucky to have him.
He's helped early stage companies where he's tried to help them enjoy some of the same success that he did. It's very much mentoring new companies, new entrepreneurs, new ideas, infusing them not only with money, but infusing them with knowledge and his experience and helping them to see the bigger picture. Because he's been to the top of the mountain, so he can tell people the best path to get there.
Dinesh really would recognize entrepreneurs' talent and get excited about their talent and really kind of believe in those entrepreneurs. Like he believes in people, and he would really encourage them. He was always kind of trying to nurture the relationship with the entrepreneur, and he used to tease that you need to nurture the cow, not just appreciate the milk, right? And take care of the cow, and it will continue to produce good milk.
It is one of those things where all ships rise. So because of his influence and commitment to this space, we're seeing continued focus and growth on the biotech and medtech spaces here in Utah, where this was not a hub for that. You would never have thought that 10 years ago. When you talk to people on the coasts who make investments in companies like this, they're taking notice. And that has everything to do with Dinesh.
How much of our success in technology is due to Dinesh Patel's decision to move here and to bring his considerable skills to the state? That's impossible to know. But I can tell you, it's a substantial contribution that is recognized by everyone in the business and the political communities in this state.
Dinesh was very involved in helping to establish this industry, particularly the therapeutics industry here in the state of Utah. And so Dinesh has always been someone that has advanced the cause of our industry in a way that has been beneficial to so many people and so many other companies.
Ecosystems don't just grow up on their own. They take nurturing, they take leadership, they take investment capital. And Dinesh he came into the state not just to start his own company, but once that was done and once he had gained momentum as a successful entrepreneur, he was willing to share that with others, which in this state was highly unusual in those days. And he built consortia that were then willing to invest in startup companies and to give life to entrepreneurs and early ideas, which today dot the landscape.
Utah's business leaders also recognize the mentoring role Dinesh played for a generation of young entrepreneurs in the state.
When you need advice from Dinesh, he's super authentic. Like he'll just come out and tell you the truth. He does it in a very respectful way, but in an honest and open way.
There's tons of people that go to him for business advice, life advice, and he's always willing to take a call and sit down with someone, take a meeting. So he's very generous with his time.
He hasn't just stepped back and enjoyed his own success. He's redeployed his own resources to help advance other kinds of technologies, both in life sciences and outside of life sciences. And he has been a mentor to many.
Dr. Patel and Kalpanaji, his wife, have been great mentors to me in ways that I've, just never even imagined. So they have actually supported me throughout my entrepreneurial journey and gave me the courage and confidence that I can go out and do whatever it is I want to do, which is right now in 10 years, we have about 8 restaurants. 5 Saffron Valley restaurants and 2 Biscott's Bakery and Cafes and 1 more coming. My entrepreneurial journey is definitely inspired by Dr. Patel's leadership and mentorship.
Dinesh is someone who he'll believe in you and encourage you to succeed, But he also makes it very clear that when you succeed, he has a high expectation that you're going to go out and do good in the world too.
Outside of business, in the past 3 decades, Dinesh and Kalpana have contributed millions of dollars to a number of philanthropic causes. They have supported more than 25 educational, community, and religious organizations in Utah and other parts of the country. They range from his alma mater, University of Michigan and University of Utah, which helped him start his first business, to iconic local institutions such as the Utah Symphony and the Leonardo Museum, as well as a number of Indian American causes and organizations.
Most of our philanthropic giving is around health and education. Those are the 2 major focus, and then of course culture is the next one.
I came to the University of Utah in 2004 as Dean of Engineering and found a wonderful friend here in Dinesh Patel. He has been such a supporter of the state as a whole and of the University of Utah and higher education in particular. He and his wife, Kalpana, have donated not only to the College of Engineering, but to fine arts and pharmacy.
Dinesh played a big role in the construction of the state-of-the-art James L. Sorensen Molecular Biotechnology Building at the University of Utah, which houses one of the nation's finest innovation hubs. The $130 million building was funded by the state government through the Utah Science, Technology, and Research Initiative, better known as USTAR, and private gifts.
He was one of the people who first envisioned the concept of USTAR, and he chaired the USTAR Authority and was a wonderful guide in those early days.
Dinesh and Kalpana not just provided the leadership from a technology and research point of view, but also they personally contributed in a big way in making that building a possibility.
I always thought I owed the university some, because I got my start at the research park in the University of Utah.
Dinesh has also given 2 major gifts to the College of Pharmacy at the University of Michigan, where he earned his Ph.D. In 2005, along with his 2 brothers, Kiran and Pradeep, Dinesh established a fellowship for first-year Ph.D. candidates at the College of Pharmacy in honor of their parents. Dinesh has served on the Dean's Advisory Committee of the College of Pharmacy for several years. The committee helps the college assess the overall strategic direction.
I always believe in that's one thing that our family always believes in, is giving back. With the education that I got in Michigan, I was able to do what I've done so far. So Michigan has been a special place. And when you're here, you're in football and all the sports activity and all that, and you become attached to your team. We've spent 4 years there, but it's like a second home.
Dinesh has made equally impactful contributions to his adopted state's cultural landscape. He has been a member of the board of the Utah Symphony Opera for more than 2 decades.
I think my longest association besides the universities has been with the Utah Symphony. And I'm still a board member, and I tell them it's about time I retired. I think I'm the longest serving board member there.
Another local institution Dinesh has supported right from the beginning is the Leonardo, a science and arts museum in downtown Salt Lake City. Since its founding more than a decade ago, he has served as an advisor and member of its board, as well as its chairman.
He has influenced the museum in major ways, and I would go as far as saying that the museum just wouldn't exist without his involvement. So he played a major leadership role in getting the museum off the ground. He was involved both on the fundraising side, but more than that, he lent his credibility and his expertise as somebody who invests in startups to a startup museum, and that is just an incredible gift he gave us. He has personally been extremely generous in contributions, and he has really been an amazing ambassador for us. His involvement alone, I think, has inspired a lot of others to trust this new venture and to be willing to invest in us. So he put not just his money on the line, but also his reputation.
Dinesh says there is a strategic business reason behind his support for cultural institutions like the Utah Symphony and the Leonardo.
You know, when they first came to see me and said, "We want you to be on our opera board," I said, "I've never been to an opera. I don't listen to that music." And they said, "What do you listen?" Well, I said, I put the radio on, it was rap music. I said, "You know, I'm listening to this music, not the opera." But I also realized that in order to attract top-notch talent to Utah and to my company, I need to have cultural activities that are appealing to people. I can't, you know, if we don't have a top-notch symphony or museum and all, a lot of people are not going to move from New York where you go to world-class theaters. So I realized that I have to be supportive of the local art cultures.
A believer in the dictum, charity begins at home, Dinesh has supported dozens of Indian American community organizations and causes over the years.
I always believe that we have to be part of the community and we have to help. And it started very early with the Indian Students Association at the university, or the Indian programs that were being brought into Utah. In fact, I would say from maybe 1990 till today, we've sponsored every program, Indian program, that has come to town.
Denesh played a major role in the construction of two magnificent temples in the greater Salt Lake City area and the establishment of the India Cultural Center, Utah. The more than 8,300 square feet center, which is affiliated to the Sri Ganesh Hindu Temple in South Jordan, promotes Indian culture and heritage.
There were a group of people who wanted to have a temple built here. At that time, there were hardly a couple of hundred Indian people here, and the big concern was, how do you raise money to build a temple and a culture center both together?
This wasn't exactly just a case of just building another Hindu or even Krishna temple. This is an area that's pretty homogeneous, about 90% Mormon, and we're not even in an urban area. This was a daunting prospect, but Dr. Dinesh Patel is never one to shy away from a challenge, nor is he ever one to hold back from his own opulences and share those and give those back to the community.
Half the money, about $1 million, actually came from American businesses. And so anybody that did anything with me ended up having to contribute. So, we have a lot of major donors there. Zions Bank being one of them, and the LDS Church. They donated money to our cause. So being involved in the community has helped getting the support from them.
One time we were in a friend of ours' back garden having a meal after a puja, and he came up to me and said, "How's the fundraising going for the new temple?" And I said, He said, "I'll match you every dollar for the first 50,000. That was the moment I knew this temple would happen. It would not have happened without Dr. Dinesh Patel. And
I was able to serve on the board for India Cultural Center, and actually I helped on the fundraising team along with under Dr. Patel's leadership, and we raised about $1.6 million to build the Indian Cultural Center.
I've had opportunities to work with Dinesh when we built the India Cultural Center. He led the effort for the fundraising specifically. He brought in industry leaders. Even the Huntsman family contributed to the India Cultural Center.
He's always been the undisputed leader of the Indian community in Utah, not because he's the wealthiest, not because he's got the most awards, but because he's a leader. He's a genuinely generous and giving, loving human being.
Perhaps the philanthropic initiative that's closest to Dinesh's heart is a hospital and community health center that he and his two brothers, Kiran and Pradeep, run in memory of their late father, the family's ancestral village of Motu Fafalia in Gujarat.
My father's vision was to have a hospital in the village. He did all the groundwork, got the approvals and everything, and then the three brothers kind of pushed it along.
The 100-bed hospital, which includes a pediatric center, serves nearly 65,000 people in villages surrounding Motofofaliya, the birthplace of Chotubai Patel. It employs 5 physicians and 10 nurses who provide primary care, obstetrics and gynecological services, an eye clinic, and general surgery services.
Just this month, in one single day, we had 18 deliveries, which is mind-boggling because we were doing 3 or 4 deliveries a day. Now, the reason why we have so many deliveries is we were one of the few COVID-free hospitals that provided top-notch care at no cost. We incentivize the ASHA workers to bring the patient in. Our goal is to have as many safe deliveries as possible.
Denesh has been partnering with the University of Utah to train physicians, nurses, and community health workers who serve at the hospital. Experts from the university routinely visit Motofofaliya for training and other capacity building efforts.
I took a team from Utah to our hospital. We found that the number of babies that were dying within the first 12 months of the low birth weight babies was about 20%, which was extremely high. And the university and Dr. Bernard Faso and Dr. Ellie Judkins, who were quite involved with our project, did a survey and figured out why is it that's happening. And one of the biggest issues was there was no follow-up. Once the baby leaves the hospital, nobody knows where they are, what happened.
When we initially went there, we did a baseline survey of health needs, and ever since have returned more than 30 times to start health projects including education, women empowerment, health surveillance, infant survival programs, maternity programs, child health programs.
When we went the first time, it was clear that there was work to be done. And motivation and the desire to want things to be done, and in terms of healthcare delivery and improving the health and the lives of the people in the community. And
the reality of healthcare in rural India was eye-opening. I think the lack of services and the lack of quality of services and the mortality associated with it. It was shocking, at the same time it was a potential. At the beginning, when we started, the baseline was that 1 in 5 babies that was born at less than 2 kgs would not live until 6 months. And right now our mortality is down to 2%, so 1 in 50.
Which is pretty much bottom.
And so we are very proud that the community actually is carrying that program now. So it's a collaboration between government, the private sector, and dedicated field workers who really make that happen. We just provide academic guidance and bring knowledge and skill, but they deserve all the credit because they do the work every day.
The work of Denesh and his brothers has made a huge impact in the realm of prenatal care as well.
Our ASHA workers, once they know a woman is pregnant, we start testing them every 3 months. In fact, the last report I saw, the number of women with anemia had dropped significantly because if we see they're anemic, we tell them what food to eat, what to do.
His tremendous success in business, decades-long work as a community leader, and the impact of his philanthropy has made Dinesh an influential figure in Utah's politics.
Politically, I've helped or worked with the last 4 governors and have been on the economic development issues in the state. I mean, if you want to make any changes or if you want to have your voice heard, you have to be part of the system.
Dinesh has used his political connections for the benefit of the community he represents and the causes he champions.
Fortunately, Dinesh is very well politically connected, and we have shamelessly used those connections. When you have the kind of connections that he has, it enables you to have access to people who make decisions who are willing to listen because of the gravitas he brings to a meeting.
Dinesh has been a huge asset for the Indian community, the Indian Americans in Utah. It's because of him that we are so well connected with the political leadership of the state. He participates in many of the decision-making bodies. He brings us, the community, he makes them a partner in many things at the state level. We celebrate Diwali in the governor's mansion every year.
A big aspect of my dad's success here has been helping the Indian American community, the Asian American community generally, and just more so minority Americans in Utah, having more influential positions and having their voices heard a bit more.
Because I never ask anything for myself. I never ask them, do me a favor, get me money somewhere or whatever. Whenever I ask, they're very responsive.
Yes, it's great to have political connections, but I think the political side has benefited more from Dinesh than he has from the political side. We're asking from him to help us, and that's where the humility comes into play, because Dinesh doesn't need political support. He doesn't need political friends. He gets them anyway, because they want his knowledge and expertise. They want him sitting at the table, helping to advise on the way forward.
John Huntsman, a former Utah governor and presidential candidate who served as U.S. ambassador to Singapore, China, and Russia, recalls introducing Dinesh to the late Singapore statesman Lee Kuan Yew.
Lee Kuan Yew told me, the founder of Singapore, who I brought to the state some years ago, and he wanted to see an example of a non-American who's American in origin succeeding in Utah, which he thought to be a very homogeneous state from an ethnic makeup. And of course he was right. And I told him of Dinesh's story, and he said, well, I'd like to meet him. I'd like to see his business.
He came and visited our facility at the time, our factory. And it was supposed to be about a 30-minute visit, and I think we ended up spending an hour and a half.
So after he met Dinesh, his comment to me was, he's very impressive. He could succeed anywhere. He could have gone anywhere and been very successful. You're lucky to have him in your community.
Dinesh and Huntsman, one of the most distinguished Utahns who has served in 6 successive presidential administrations, have a decades-long friendship. In 2004, when Huntsman was elected as governor of Utah, he tapped Dinesh to be on his transition team. Dinesh also touched the Huntsman family in a deeply personal way.
I have an Indian daughter, Asha, because of Dinesh.
We were on our way to India. We were sitting in the airport in Atlanta, and Mary Kay, that's John's wife, she calls up and says, well, we have a daughter from China, we want one from India. So when we went to India, my cousin Jitendra, who runs our school and hospital, I talked to him, and within a few weeks there was a baby that was abandoned close to our village. And he took the picture, sent it to me, and the Huntsman family immediately said, this is the baby we want.
My wife, Mary Kay, and I will never forget the call that we got from Dinesh, where he said, we have found Asha in Gujarat. It changed our lives.
It took us close to 12 months to get it done, but of course Asha has blossomed into a wonderful person.
We decided with Dinesh what her name would be. We loved Asha, but to have the meaning hope behind the name is very special given Asha's circumstances and where she came from. Her middle name is Bharati, so we call her the Hope of India, which makes her extra special. And I tell Asha all the time, Asha, you're carrying a very important obligation and responsibility because of your name.
Those close to him say Dinesh is a true and generous family man who is strongly attached to his children and grandchildren.
And he puts his family first. Dinesh always values his family first, and you can see the joy and the love he has for his family.
And even though he goes so many places and takes care of business, politics, community work, still he makes time for me and children and grandchildren.
So I think growing up, we probably didn't even realize that he was running his own company and had probably over 200 employees working for him. And I think it's just because of the fact that he was always so present at home too, you know, whether it was coming to our school events or helping with homework or making sure that we went on that family trip every year. You know, he was just always there.
His North Star is family. How do I keep them safe, healthy, and moving forward? And I think everything comes back to his nuclear family, but then his wider family. He's so loving. He's a giant teddy bear. So, you know, you can take him out of a boardroom where he's very serious and you put him with his 4 granddaughters and he just melts.
Dinesh says he owes a great deal of his success to Kalpana, his wife of nearly 50 years.
In the early days, she was a breadwinner. We were just starting up a company and she was working in the lab. So, total support. If you don't have that, there's no way you can succeed.
When they were in Michigan, he was just a student, so she was working actually and supporting them during that time. And then even when they moved to Utah and my dad was starting the company, she was working at a lab in the at University of Utah. So I think that obviously played a part of like helping with the finances at the time. And then of course she helped in the sense of raising my brother and I.
You know, his wife is as equally part of their success as Dinesh is, and Kalpana is an amazing woman, and just to see the tenderness and the care he has toward her, it's just really inspiring.
You know who's boss? She's boss. He listens to her. He really trusts her and her instinct. The mother's always the connector. The mother's like the heart, right? And he's always been the head, and they have a great sort of dynamic between the two. You can tell that she's in charge, and I think he likes it that way.
All the Patels in the house, say yeah! Now, all the Dingras, say yeah!
One family event that exemplified Dinesh's devotion to his family, the 2014 wedding of his daughter Avni.
He put on an incredible wedding for his daughter here in Utah that was like the wedding of the century. In fact, my daughter liked it so much, she declared that Dinesh was her godfather.
Well, more than anything, my daughter wanted a big wedding. Obviously, the weddings, Indian weddings, tend to be 3 to 4 days. So that's something for an Indian person, 3 to 4 days wedding is not that surprising. But in Utah, having a 3 or 4 days wedding with all the people, it did create a lot of news.
Yeah, I told him I want to hire him for a year to create a cool, sophisticated wedding, you know, and it was definitely a production. I think it was, even though he's so busy, he really made that his priority and made it come together.
You know, she picked the right person to hire. That's there's no argument there.
And each day was this incredibly huge, I mean, just huge events, and anybody was at this wedding, right? And normally you'd say, oh, the mothers are the ones that drove the wedding, but Dinesh was the one hands-on driving that wedding and doing all the over-the-top things, and it was just so fun to watch him put that whole display on for everyone because he loved his daughter so much.
It was incredible. It was unforgettable. You know, I think it was definitely, you know, a moment we'll never forget in our lives.
It is nearly 5 decades since Dinesh Patel's American journey began. It is more than 38 years since he set foot in Utah to start his entrepreneurial journey, which enabled him to create immense wealth and allowed him to engage in impactful philanthropy in both the United States and India. Despite all his accomplishments, Dinesh is still as active as he has ever been.
People ask, why are you still working? I still have office hours. I mean, it's flexible, but I have office hours. I like to do that. I like to have some rigor in my life. And I think if you're mentally active, mentally happy, you live a longer, happier life.
He could have just gone and sat on beaches and gone golfing, but you will never find Dinesh Patel sitting out on a golf course or just chilling on the beach. He's out there helping. He's helping in the community, in the universities, he's helping in the politicians. He's really trying to drive change and to make things better for the world. Not because he has to, but that's what he chooses to do with his time.
Dinesh is grateful to Utah for all he has been able to achieve.
From my perspective, Utah has a lot of innovation. The people are very friendly. And that's what makes it a good place for me. And also it's a very small place, so that's where you can have more impact. If I was in San Francisco, Bay Area, who would care about Dinesh Patel? You know, you're just another face in the crowd. And here you can make an impact, not only personally, but on the community. So for me, that's been the big deal.
I think Utah is better for Dr. Patel having landed here, but probably Dr. Patel had greater opportunity here because of how welcoming the state really is to people of all stripes, of all persuasions, of all religions.
Dinesh Patel's life fits the pattern of those great American stories where an immigrant who comes from a different corner of the world arrives in this country and is able to open doors by taking advantage of the opportunities that existed and gives back to this community.
He's a great example of not only an American success story of coming and starting at a very low rung on the ladder and rising to the highest levels, but then he didn't forget what the journey was like, and he's given back. He continues to give back over and over again, and he makes a difference for people.
He believes in that dream for people, but then he wants to also, not having just accomplished the dream himself, he wants to turn and help other people accomplish that American dream as well.